The problem that I was trying to solve for Family Care Center when I first started is while I was still active duty. So as my last job in the military was the chief of behavioral health for Fort Carson, Colorado. And I had a lot of resources, about 200 employees and a very, very big budget. But less than 10% of my budget and my employees were focused on family care. I tried to solve a mission of how do I take care of my family members? One, to sustain the rest of the military, to sustain my brothers and sisters in arms, to take care of the veterans. And it was just remarkable how we grew. So it started with about 12 people that I had kind of convinced from a failing practice. Hey, would you come with Family Care Center? I bought some old computers and desks, and then we started Family Care Center. I was trying to solve the problem of how do I care for our military? How do I care for the mission? But for those that have the least amount of access, have the least amount of care in the communities, and how, if I'm going to lay roots, and this is where I'm going to live and raise my kids, then I wanted it to be the best community ever. And the best way is to have a full spectrum of care. And so I couldn't find it, and so I made it. I was so excited when we began. Our first week, we had 8 intakes. All right, so that was in 1 February 2016. And I was ecstatic that 8 people wanted to see me. Now we see almost 18,000 encounters a week of taking care of people. I think that scalability with an improvement of our outcomes. In the beginning, when I was measuring, I was, about 6 and 10 would probably get better or improve. This is to include with TMS. As we've measured, as we've added more expertise and more kind of clinical guidance, and giving them more bandwidth to the clinicians to making sure that environment that they're practicing in is very, very supportive. And we're taking care of the administrative burdens so they can focus on their craft. We have pushed that to 8 and 10. And actually in some studies that I have had, some research, I have hit in 9 and 10. So basically the majority of people that come see us, especially for depression and anxiety, we're getting them better. And we're trying to increase those indications and looking at PTSD, social phobia, general anxiety, and many different things. I mean, we take care of the whole bandwidth. One of the biggest differences between some of these other places is, one, we're in person, so we're brick and mortar, right? And so that's our sustainability, is that we're doing these things in person. I believe since starting psychiatry, actually medicine in general, that experience is very important. We do have options for tele, just like anything else, but we're not a tele only, which is really been the soup du jour since COVID, and actually a lot of business models right now. The other thing is we're multidisciplinary. So it's not just having 1 or 2 providers of a different specialty. No, we have a whole range: registered play therapists, social workers, LPCs or licensed professional counselors, psychologists, psychiatrists, nurse practitioners, physician assistants, all with that directed mission to take care of their patient. And guess what? Collaborating. They're all underneath the same roof. So we've got multi-specialties with collaboration of care, able to focus on the patient and then really kind of talk about how do we get this person into a better place and in a better experience. And I think our outcomes speak for themselves. We look at those things critically at ourselves, and we try to get a better experience. So both the multidisciplinary aspect of a family care center and that collaborative care model really sets us apart. I think another piece is that TMS, or transcranial magnetic stimulation. It is another tool, another piece of the pie, but we have it under the same roof. Each one of our clinics has TMS capabilities, and so that is also in person. That really makes Family Care Center stand out. Our outcomes show that we are different, right? So we measure our outcomes. Our outcomes are industry leaders. It's about a 52% kind of outcomes in general for most behavioral health when you deal with depression, anxiety. We're hitting in the 80th percentile, even higher. And so these are things that are very meaningful, and they're actually identifiable, and they're actually reproducible. And we've done this now 46 times in 5 different states. completely surreal and very humbled that, one, we have so many people that have heeded the call for the mission to improve the lives of our patients and our communities. Our communities now, it's not just like, oh, it's nice to have. They rely on us to be the employer of choice. I really want people, when they think of behavioral health or a great place to work or to practice your craft, is family care center, right? That we can actually have such a high retention. People are clamoring, or we've got to open up more clinics, or we've got to do things because we are trying to meet the needs of our providers and our employees, improving their lives. I think that has got to improve our patient outcomes. It's got to improve the experience for the patient. They're the ones that benefits. The patients are going to benefit when the providers are happy, they have a balanced life, they can live and work and play, and then bring their A game for these very stressful crisis moments. I think by us being that employer of choice for behavioral health, it's going to help us open up 90 clinics, 100 clinics. I've already met all my personal goals, and so each day has just been a blessing. And so I think that the next 10 years, if we increase that scope, help TMS kind of grow, be that employer of choice, and improve the patients' lives, I would be more blessed than I am right now.